Tom Wiggins? I go, yeah, he was my boss. He says, he's sitting right there. And so, you know, some 40-some years later, we hooked up and we become really good friends since then. One other interesting thing is he came to my wedding. He came to our wedding of 50 years. So Sandy and I had our 50th anniversary in July. So 50 years ago, he came to our wedding. Anyway, so this is Dr. Tom Wiggins. Dr. Wiggins is obviously a physician. He worked at St. John's Hospital as what were you? An anesthesiologist. He was an anesthesiologist out there for many years, and now he's retired from that, and he works primarily with marijuana. And so, Dr. Wiggins, why don't you come up and give them all your amazing knowledge?
Hello there. So I went to medical school, college and medical school at the University of Illinois. And I got out of Illinois after medical school as quickly as I could and went to intern at LA County General Hospital, 1200 North State Street, Los Angeles, California. And just by way of background, most of you know a little bit about medical schools. There's one at UCLA. They got 52 students in a class. There are big schools back east, like the University of Illinois. We have 225 students in the class. We graduated 225 people. The same thing's true of Ohio State. Big schools back east. Most physicians are educated east of the Mississippi River still today. University of Illinois is across the street from Cook County Hospital. There's 4 1,000-bed hospitals in the United States. Bellevue in New York, Cook County in Chicago, Charity in New Orleans, and LA County General in Los Angeles. LA County is such a well-known internship that 16 of us, 16 members of my class, went to that internship. Maybe 20 went to Cook County because it was across the street. But LA County was by far the second numerous choice for the internship. So after my internship, because they had a draft, there was a separate draft for physicians. We weren't subjected to the draft that everybody got drafted into to go to Vietnam in the Army and become what we lovingly call a grunt. But they had a separate position for a separate draft called the Berry Plan. And they would do things like defer you to take a residency, and then you'd have to come in the Air Force or the Army or the Navy after your residency. And I was in the part of the Berry Plan where I agreed to come in right after my internship. And what I got for that was I got to pick my branch of the service. So I picked the Air Force. So when I was at that air base in Texas, where David was taking my flight surgeon training, which the Air Force gave me 3 months of aviation medicine training so I could take care of pilots. There were classes going through Fort Sam Houston, the big Army post, for doctors. There were 400 doctors in a class for the Army, going through 6 weeks of basic training and off to Vietnam. 400 in the class. We had about 50 doctors in my flight surgeon class. So after that, I spent 2 years in the Air Force, during which I was in Vietnam about 6 months, and I didn't take care of any sick people in the Air Force, except in Vietnam. I had to deal with officers who like to get VD because they weren't behaving well, so I took care of them. And people who had psychiatric problems. I had a guy have a panic attack while he was taxiing a big C-134 engine airplane and drive it into the swamp. And I had a heck of a time getting him medevaced. I was real fortunate because the commanding officer at our hospital back at Davis-Monthan, we were at Benoit Air Base, was a psychiatrist. The colonel was a psychiatrist, so I called him up. He said, I'll help you get him on the medevac, because the CO just wanted to court-martial him, because he didn't recognize psychiatric illness and panic attacks, for which marijuana is a really great treatment. After the Air Force, I didn't know what I wanted to do, so I ended up doing general practice in Waukegan, Illinois. An old guy slipped and fell off his boat, broke his leg, and I took over his practice. And I did general practice for a couple of years, and I decided, well, this isn't going anywhere. And one day I was doing a DNC in the, I used to have about 20 patients in the hospital, doing a DNC, and the nurse anesthetist says, we can't start till you get here because the anesthesiologist is not here. I said, what do you mean he's not here? And he said, well, when he's not here, the other doctor can be the doctor supervising the nurse anesthetist. I don't have any idea what you're doing. I told him, so I'm supposed to supervise you. So I said, well, I found out he charged the patient $1 a minute for the nurse anesthetist. We had 10 operating rooms in the hospital in Waukegan. We stopped and think about it, he had 20 nurse anesthetists. It's an awful lot of money here. It's like $3 million a year going on here, So I said, I think I'll get interested in anesthesiology. So I went off and took they call it a residency, 3 years of training in anesthesiology. I got really good credentials. I did my anesthesiology at the Mayo Clinic in Rochester, Minnesota. And I ended up finally in 1976. I'd always wanted to come back to California because my parents were in Camarillo, and by that time. And I got a job at St. John's Hospital in Oxnard. I practiced in the old hospital on F Street. I don't know if any of you know where that is. Some people do. For 20 years. And in the 90s, we built a new hospital on Gonzales and Rose. It's actually on Rose and Gonzales. And I was there for 10 years. So when I retired, you could conservatively say I'd given an anesthetic to 1 out of every 4 people in Oxnard. So it's like 40,000 people. So it's a long career. You do brain surgery, you do heart surgery, you do so much obstetrics you can't believe it. My favorite thing was to be the laboring lady's friend and give her an epidural and relieve her pain. That was the anesthesiologist's chance to not put somebody to sleep, to actually talk to them and be there with them and get a lot of appreciation. So I enjoyed that. Another thing I did was to give people with back pain. Back pain is usually caused by degenerative disc disease. That is, the disc between your spinal bones, your vertebrae, has collapsed and deteriorated. That's putting pressure on the nerves as they exit the spine. And one of the things that's done with that is called an epidural steroid injection. Well, you can give people prednisone by mouth, that's a steroid, and it'll reduce their inflammation, reduce the swelling. The theory being if you reduce the swelling around the nerve won't be as irritated and painful. So you can put the steroids right in their epidural space, which is the space around the spinal thecal sac, which contains the spinal fluid, and the nerves are inside there. So I gave a lot of people epidural steroid injections, and sometimes it helps. But not always, and sometimes it helps for a week, and sometimes it helps for 3 months. Anyhow, I did that like all the other anesthesiologists. And then my son, who's a graduate of Ventura College, of this school, before it was legal, got into marijuana and stayed in it. And was a pretty successful grower at times, and he's out of it now, finally doing something else at the age of 50. But he said, well, you want to get out of the operating room. I was, getting close to 70. The operating room is tense. It's actually a fairly tense place at times. And anesthesia, a lot of us in medicine would say there's 2 specialties, anesthesia and obstetrics, which share one kind of common characteristic. That is to say, 90% of the time, it's terribly simple. 90% of the time, and 10% of the time it's simply terrible. You have emergencies in these two fields that you don't have in when you're doing internal medicine, for instance. So, where was I? I lost my train of thought.
Well, you were explaining how you did
I got
these
into
two things.
got into marijuana.
Yeah, how you got into it because
Right.
of.
So my son says, well, I wanted to get out of the operating room. I wanted to retire at 68. Most anesthesiologists retire around 55 because it is a stressful business. But I had kind of graduated to a little surgical center over on near St. John's called Channel Island Surgery Center. And I'd done something I'd wanted to do my whole life, which was to hire nurse anesthetists. In California, they don't really allow nurse anesthetists except places like Kaiser Permanente. But the way surgery centers are set up, there's not enough money to satisfy your typical greedy anesthesiologist. So I managed to hire 5 or 6 really good nurse anesthetists from Kaiser and run that surgery center with nurse anesthetists like we did at the Mayo Clinic for 10 years. The Mayo Clinic did 2 really important things in anesthesia. It invented nurse anesthetists. That's where, and the most, they train more nurse anesthetists at the Mayo Clinic today, like 60 a year, than they do anywhere else. And they invented it. And they invented sodium pentothal. Well, I spent my whole life giving people pentothal, and then all of a sudden, you know, the Michael Jackson drug comes along, Diprovan, propofol, and pentothal went out of fashion, and everybody gets Diprovan. I never thought it was as good as pentothal for crash C-section, personally, because I was always afraid the women were gonna say, "I remember you cutting my stomach open," but it didn't happen often. So I told my son, Tom, okay, go ahead and open an office. So you couldn't believe it. At that time, in '96, they passed Prop 215, and they made marijuana legal medically. And so this was about 2008 I did this, 2009 in there. And you got patients lined up outside the door. I'd like a show of hands. Just talking about marijuana, just talking about smoking it. Just talking about smoking marijuana. Is there anyone in this room who puts their hand up and say they've never smoked marijuana? Well, he's ingested it. I finally got one of the things. It took me a couple of years to get Dave to ingest marijuana for his lack of sleep. He had real sleep deprivation. And marijuana is good for 3 things: pain, sleep, and anxiety. Those are the 3 biggies. Those are the things it's good for. So there were days we had 80 patients. And I was just doing it on Saturdays and still doing anesthesia. But after I quit doing anesthesia, I started going down to my office is in Temecula, California. That's where my son set it up. And it's still there. I had 15 patients Monday and 11 Tuesday. Why do we have those patients still when marijuana is legal? They don't sell marijuana in Orange County. I mean, they're a crazy, the whole marijuana situation is still crazy. I mean, there's no reason why they shouldn't sell marijuana in Orange County. But they don't. It's not Orange County, I'm sorry, Riverside County. Temecula's in Riverside County. It's a redneck place. That's all you can say. That's all you can say. Anyhow, there's more to it than that. You can get a license now to grow marijuana from the state, but you can't get the state license until you get a local license. The local license can be either county or municipality, city. But you can take your municipality, your license, Carpinteria does it. You take your Carpinteria license up to Sacramento and they'll give you a state license. And my son was been working at a marijuana grow in Carpinteria lately, because he's very good at growing marijuana with wonderful genetics. That's the whole thing they talk about in marijuana growing is how are your genetics, you know? So. Proposition 215 went to the California Supreme Court because somebody wanted to grow his own medicine. And the state of California said, you can't grow that many plants. And the Supreme Court of the state of California said, marijuana is a legal medicine. He has a right to grow as much marijuana as it takes to produce the amount of medicine he needs. So you can't say how many plants he can grow. Well, didn't take us marijuana doctors long to pick up on that. You know, so we thought about it and we came up with the 99 plant rec. So we give a guy and say, this guy needs to grow as much as 99 plants to make enough marijuana for his condition. And people do use a lot of it. People bathe in it. They do everything with it. Cook it, eat it, whatever, you know, it's just that they rub it all over themselves. People can use a lot of marijuana. So you get people in Riverside County come to me and they get a 99 plant rec, and then they take that to the County Department of Public Health. I don't know if you're aware of it, but here in Ventura County, you can also go to the County Department of Public Health. It's located on Gonzales in Oxnard, and get a California State Medical Marijuana Patient Identification Card. But you gotta have a recommendation from me first. So it's gotten to the point now in Riverside County where patients go into the Department of Public Health and say, I wanna get a card. They say, well, go see Dr. Wiggins. So why do they wanna grow marijuana? Because there's no marijuana dispensaries in Riverside County. And far be it from me, I don't know they're selling it. If I ask them, they're not selling it. But a good grower can grow 4 pounds of marijuana from one plant, 99 plants, 400 pounds of marijuana. What's marijuana cost? $45 for 1/8 of an ounce? It's a lot of money. A lot of money. So everything I know about marijuana, since I started giving out what people call licenses, but are actually recommendations, is from patients. I've been doing this now 10 or 12 years, and I got 37,000 patients. Different people, yeah. And I've talked to all of them. Well, it's an interesting business for me because when you're an anesthesiologist, most people come in, you put them to sleep, you don't talk to them. I never talk to patients much. I realize now I maybe should have done something different because I like talking to patients. And patients, of course, can't believe that there's a doctor there who will listen to them, because doctors don't listen to patients. That's not what they do, huh?
There's only about 20 seconds before
20 seconds. The average physician interrupts the patient after 15 or 20 seconds. They're not going to listen to you. I had a lady come in with neurodermatitis. Neurodermatitis is caused by scratching yourself, and you only have rash where you can scratch. And I told her to start using marijuana, and she quit scratching herself, and her neurodermatitis went away. You tell me that's not a cure? There's a common condition that your dentist will tell you about called bruxism. Bruxism is people that grind their teeth, and you can actually tell people that have bruxism because if they open their mouth, their teeth are straight across. There's not one that's higher than the other. They're just straight across because they grind them down to even across. Those people take marijuana at night, they quit grinding their teeth. it cures them. Okay, answer the question, go ahead.
Well, I have a question about that, because my mom has been talking to me about how she'll wake up and she's like grinding her teeth in the night. So what does it do to, like, what is the reaction in their mouths to keep them from grinding their teeth?
It's in your mind. You grind your teeth because of anxiety.
Right.
So the marijuana relieves the anxiety.
So then, yeah, okay.
This is really interesting part of the discussion, because I've just determined in my own way of looking at this, marijuana doesn't relieve anxiety like a Xanax. Take an alprazolam, a Xanax tablet. That's a minor tranquilizer. It relieves anxiety. Marijuana doesn't relieve it, it prevents it. You got receptors in your brain, you know, for all kinds of things. Epinephrine, norepinephrine, dopamine, serotonin. You also got receptors in there for cannabinoids. Tetrahydrocannabinol. You got a receptor in your brain and in your gut and in your nerves. Just like you do for, and your body makes its own. Your body makes its own cannabinoid. It makes an entity to fit in those receptors. And the serotonin receptors, they give you Prozac, so you get more serotonin. So it'll relieve your anxiety, your depression, in the case of Prozac. What does the cannabinoid receptor do? That's the real question. I figured out what it does is this big word, homeostasis. Homeostasis is a word that means to stay on the level. Your temperature stays in a certain range that's homeostatic. Your bowel movements work in a certain range that are homeostatic. And sort of another word for a big word for normal. But it's not normal to be depressed. It's not normal to be anxious. And what the marijuana does, the receptor is, it causes happiness. It causes you not to get depressed and not to get anxious. It doesn't treat either one of them, it just prevents them. Which, if you look at one of the miracles of marijuana, it's called migraine headaches. 1 person in 7 has migraine headaches, they say. And if you're gonna get a migraine headache, you might see spots first, get a little nauseated, you feel it coming on, and you smoke some marijuana, it'll help. But if you will use a little bit of marijuana every night, a little bit, your headaches will go away. You won't have them anymore. It will prevent them. I have got hundreds in my 35,000 patients, hundreds of migraine patients. And I have some who have never had another headache. But every one of them, if you're the kind of migraine patient that gets Botox injections because you've got 15 headaches a month, you may not cure yourself, but you're going to see a dramatic decrease in both the frequency and the severity of your headaches. You may have 1 a week or 2 a month instead of 15 a month if you'll do a little marijuana every night. Well, what is a little marijuana? It's a couple of flakes in a bowl and you smoke it. That's what a little marijuana is, right? I mean, you guys all know that. What is a couple of flakes in a bowl? Well, an eighth is 4 grams, right? What is a couple of flakes in a bowl? 10 milligrams? Okay, what I do when I get somebody who comes in that don't know anything about marijuana, it takes me at least 10 minutes sometimes to tell them what's in this book. Now this book is where, I think Dave gave you a handout, and it came from this book. This is a book by Bonnie Goldstein. There's her picture on the back. Bonnie practices in Manhattan Beach, and I always tell patients, now you can go see Bonnie if you want to, although I hear she's expensive or she's not taking new patients, and she doesn't really care for adults that much anyway because she's actually a pediatrician. But she's in Manhattan Beach, but if you don't have to go see her, you can buy her book for $26. It's a lot cheaper. And everything you need to know about marijuana is in this book. Everything. So I just tell them quite simply, what the book says is, marijuana is not a prescription. You gotta figure out how to use marijuana that helps you, but there are certain general rules. The general rules are, number one, you wanna do the whole flower. The whole flower is the bud on the female marijuana plant. That's the thing people smoke. Bud. That's the whole flower. Well, you don't have to smoke it. You can eat it. The only way you can eat it is take the flower, the bud, mix it up with butter, and bake with the butter. Make the proverbial brownie, and eat the brownie. All right, let's think about that for a minute. You got these two ways of doing it. You can make it into a brownie. You can smoke it. You smoke it, you're smoking a few flakes in a bowl. And we said that maybe 8 milligrams of bud. Well, what's in that 8 milligrams of bud? Well, it used to be 6 or 7 or 8% THC. Now it's 20% THC. So you got 2 milligrams of THC in those few flakes in that bowl now. Well, that turns out to be what it takes to help most people sleep. About 2 milligrams of THC. But you can put that whole eighth of an ounce. And what's in there? 800 milligrams of THC. Not 2, 800 milligrams of THC in that eighth, right? If you tried to smoke that eighth, think about it. You tried to smoke that eighth, you'd have to smoke all day and you wouldn't have it all smoked. Right? It's hard to get too much marijuana smoking it. Some people can't even get enough to help them sleep smoking it. But you can make it into a brownie. If you got a pan of brownies, I'll bet you can eat that whole pan of brownies in an hour. All of a sudden you got 800 milligrams. I'm telling you, you're lucky if you don't jump off the top of a building thinking you're Superman and you're gonna fly. It's way too much, 800 milligrams. And that happened in Colorado before they got a good handle on edibles. That happened. A couple of people were so psychotic that they did things like that. It doesn't make people commit suicide. It just makes people do something stupid. So I tell people, okay, you take a little bit of marijuana. What is that for a woman? It's probably 2 milligrams to 5 milligrams. What is that for a man? It's probably 5 milligrams to 10 milligrams. David is 10 milligrams. Well, that's normal for a man. One of the things that really struck me about medicine is that people don't really understand that men and women are not the same. Doctors give out Ambien. Ambien is a Schedule III drug for sleep. It's more psychoactive than THC. You wake up driving the car. You know, you don't do that with marijuana. So it took them 10 years to figure out that you can't just give out one size pill of Ambien. Everybody's not going to take 300 milligrams. Women are much more susceptible to it than men. And that's also true of marijuana. As near as I can tell, women are much more susceptible to it than men. Hey.
Is that based on body size, or?
Some of it's based on weight.
Okay.
Some of it's based on weight. But not all of it. I think some of it's just the difference in the sexes. But 35,000 patients. I've had one patient who stayed high all the time, and I quit giving him a recommendation, even back when he wanted to get marijuana, because it didn't help him. And I've had one who got marijuana sickness. Marijuana sickness is a peculiar thing where you're nauseated all the time?
When I was younger, I quit smoking for about a year. And then when I went back to smoking for about 3 months, every time I smoked, I'd throw up.
Yeah,
Every single time.
right. Well, the only thing you can do is quit smoking marijuana. I don't know how, or did you get through it?
During that time, I was kind of being forced into, or get through the throwing up.
Yeah.
Oh, of course, yeah.
Well, then you're, well, I mean, but this is an interesting thing. Marijuana is the best treatment for nausea. I was an anesthesiologist all those years. All I did was give people on Dancitron to try and prevent their nausea. But nothing works for nausea like marijuana. It's the best thing. Go ahead.
Same thing, when I was a teenager, if I smoked it, I threw up.
That's too much then.
I didn't smoke forever, and then when I turned 30, my ex-husband goes, try it again.
Yeah.
Then I did, I couldn't get enough of it. And he goes, can't get any higher. But it
Anyhow,
helped with
if it
sleep,
makes you-
appetite, everything.
If it makes you sick, that's a bad sign. That's a really bad sign. Because it's supposed to treat nausea. But,
So what about like, cause I've known people that like, that were always fine with weed, but then they all of a sudden started getting really paranoid, where they never experienced that before.
yeah.
And yeah, like they just, like, I have a friend who was always smoked weed and now he just can't at all, like he'll freak out,
Right.
but.
Well,
that's-
what the book says is you'll
I
quit
don't
for a
know,
week,
but
then,
you always-
but paranoia is just too much THC, basically.
Yeah.
You just gotta cut back on THC if you get paranoid. So the way I look at it is a little bit of marijuana will help you sleep, a little bit more will give you the munchies, right? A little bit more will make you euphoric, you'll get high, which is pleasant, but a little bit more than that will make you psychotic, you'll hallucinate. So those are kind of the 4 stages. So what I tell people, I just deal with it clinically. You've got anxiety and insomnia, right? These are the 2 things that people come to the doctor about all the time. Just figure out, and the book is all about that. Start low and go slow. Increase your dose of THC very slowly. Find out how much THC in milligrams does it take to help you sleep. That's it. You don't need that's not gonna make you high. Not gonna give you the munchies, not gonna make you paranoid. Figure out how much it takes to help you sleep. That's how much marijuana you should use if you want to prevent your migraine headaches. Use that much every night.
Are there strains that you recommend, like is it indica or sativa, or is it
Well,
hybrid?
I mean, all you know about that is, I got sidetracked. So the book says use the whole flower. What's the next thing the book says? Use a high CBD strain. And I don't care what you're trying to treat. Pain, sleep,